Welcome to another lesson as we cover neurologic diagnostic procedures. Cerebral Computed Tomography Scan. The purpose of a CT scan provides cross-sectional images of the cranial cavity. A contrast medium can be used to enhance the images. How it works is that CT scanning can be used to identify tumors and infarctions, detect abnormalities, monitor response to treatment, and guide needles used for biopsies. Important key points to know. Pre-procedure. If the client is pregnant, a determination of the risks to the fetus versus the benefits of the information obtained by this procedure should be made. Nursing actions. If contrast media and/or sedation is expected, instruct the client to refrain from consuming food or fluid for at least 4 hours prior to the procedure. Assess for allergy to shellfish or iodine, which would require the use of a different contrast media. Assess BUN and creatinine because contrast media is excreted by the kidneys. The head must be secured to prevent unnecessary movement during the procedure. Because this procedure is performed with the client in a supine position, placing pillows in the small of the client's back can assist in preventing back pain. Ensure that the client's jewelry is removed prior to this procedure. Intra Procedure. The client must lie supine with the head stabilized during the procedure. Although CT scanning is painless, sedation can be provided. Post-procedure. Nursing interventions. There is no follow-up care associated with a CT scan. If contrast media is injected, monitor for allergic reaction and changes in kidney function. If sedation is administered, monitor the client until stable. That ends the lesson on neurologic diagnostic procedures. Check out our other nursing videos to help make studying easier. Also, see below for useful links that take you to NCLEX style quizzes, nursing study guides, and more.